Hello, this is Peter Panagos. I am a professor of emergency medicine at Washington University in St. Louis, and I'm here today with Dr. Nawaf Yassi, who is Associate Professor of Neurology at the University of Melbourne. We're very fortunate to have him here today because we are going to hear about the STOP-AUST trial, which will be presented at ISC 2020. Can you tell us a little bit about this trial and some of the motivation leading up to its design?
Yeah, well, STOP-AUST is a phase 2 randomized controlled clinical trial in patients with acute intracerebral hemorrhage who present within 4.5 hours of stroke onset. We know that intracerebral hemorrhage, although it is the less common form of stroke, it's certainly associated with a high degree of morbidity and mortality. And compared to ischemic stroke, there are very few evidence-based therapies. And so we performed this trial in patients presenting early, within 4.5 hours of their stroke, who were also sub-selected by having the CT angiography spot sign on their baseline imaging. Okay. And this is a sign of ongoing extravasation of blood into the hematoma and a risk factor for ongoing hematoma expansion.
I understand. The
patients were randomized 1-to-1 to either receive placebo or the study drug, which was intravenous tranexamic acid. Okay. And the primary endpoint of the trial was hematoma growth, which was assessed on CT scanning at baseline and 24 hours. And the primary endpoint was defined as growth of either 33% or an absolute growth of 6 mils, similar to previous trials.
Okay, understood. TXA, or tranexamic acid, is fairly commonly used in many emergency departments and many hospitals.
That's right.
Why did you choose that drug? I know many of the previous SPOT trials looking at ICH growth have used recombinant factor 7. What were the benefits of TXA?
Sure. So as you said, there's been a large interest in recombinant factor 7 and several trials in the past. Much of the burden of intracerebral hemorrhage around the world is in countries with low income or middle income. Mm-hmm. And in those sort of settings, very expensive treatments such as recombinant factor 7 may not be practical and pragmatic, which in comparison to tranexamic acid in the Australian setting, for example, the cost of a single vial of tranexamic acid is about $5 Australian. Mm-hmm. And so if this is shown to be an efficacious treatment, then it could be much more generalizable on a global scale.
Understood. I noticed you had a fairly long recruitment period. Some of the trials in North America had difficulty recruiting these patients in the trials. What were some of the challenges for recruitment?
Yeah, the trial recruited from 2013 to 2019, and we recruited 100 patients over 13 sites in Australia, in Taiwan, and also in Finland. The challenges were in the recognition of the spot sign. We used fairly liberal definition of the spot sign for our selection, but also these are very unwell stroke patients, and similar to other trials such as STOP-IT and Spotlight, there were challenges in rapid recruitment.
So what are the next steps?
Yeah, so our primary result really was that there was a reduction in hematoma growth with tranexamic acid, an absolute reduction of 8% compared to the placebo group. However, this wasn't statistically significant. But in some of our subgroup analyses and post hoc analyses looking at different time epochs, there seemed to be a particular trend with an increased effect in the much earlier time windows. And so this, in combination with other emerging data showing an increased risk of hematoma expansion in the early time windows, has really given us the impetus to take this into a much more early hyperacute intracerebral hemorrhage time group. And so we've actually commenced recruitment in the STOP-MSU trial in Australia, which is a similar design within the 2-hour time point, using the same dose of tranexamic acid, but within 2 hours of onset. And this trial is being rolled out in mobile stroke units in Australia, as well as within emergency departments.
Understood. Well, thank you. Well, thank you very much. I appreciate you presenting your science at ISC 2020. Thank you.
Thank you.